haven't used.
Oh, and I think we lost Kathy.
Oh dear. Well, started to record and she disappeared. I'm sure she'll be back. Yeah, I'm sorry, Jeremy. I meant to start recording at the beginning and it completely fell off my radar. So when I'm sure you're going to share the slide deck, so I'll pass the slide deck along, and that will suffice, I'm sure.
Absolutely.
Thanks for that. We'll just wait for Kathy to rejoin. Hopefully she didn't have a Zoom crash.
Hopefully, in the meantime, I am going to do the backup thing and
Oh, here she comes.
My system. Oh, good.
Sorry about that, everyone. That was terrible timing.
Yeah.
Luckily,
Did your system just crash, or I thought I started the recording and everything crashed?
I don't know what happened, to be honest, but happy to be back. And PS didn't go away, so also happy about that. So let's just get myself to the right spot again here. And I will share my screen with everyone. Make sure you can all see it. Okay, are you able to see the screen?
Yeah.
Yes.
Wonderful. So as I was saying, if you have a question as we're going through, please don't hesitate just to ask as we're going. The toolbar does house all of our tools, and honestly, to save some real estate in PS is always a nice thing. For diabetes specifically, there will be 3 different things here. It will say that the tool's never been done. It will say last visit, and that would indicate there is a confirmed diagnosis of either pre-diabetes or diabetes and the date the tool was last used. If someone was screened in the past, but they don't have a confirmed diagnosis, it would actually have screened date. So that would be listed as well. But to enter the tool, you just click on the use case you would like to use. There we go. And this is what our tool looks like. So we do have a dashboard here, and this is collapsible. It is available in all of our different, what we're calling modules. So you notice here that we do have a full visit listed, which means all of our modules are showing on the tool. Once clinicians are a little more familiar with the tool, quite often they would go through and just choose the module they would like to work in for that patient visit. I always like to leave it on the full visit as we're doing a tool demo, just to give a better idea. Now, this is a big tool. There is no expectation that a clinician works through the entire tool each patient visit. Just wouldn't be realistic. So I always want to highlight that. It does align with billing codes, and it's very similar to a flow sheet that OH would ask you to use. So you have those 365 days to work through it. At the top, it does give, now we don't have billing in our instance, but if you use billing codes, it does give you the date that the last KO30 and Q040 were billed. And that's to help you make sure you don't miss out on those incentives. We do have our diagnoses up here at the top. You'll notice in this tool in a few different areas, you're actually able to change the defaults based on the patient you're working with. So default for screening for diabetes would actually be 6 months by the quality standards, but I've changed my patient to 3 months. So this insert from previous function, personally, I think it's great. I think it's great for a couple reasons. All you have to do is insert from previous. It does give you the date it was last used. Now, I had a demo earlier today, so mine was actually earlier. I would click yes, that I agree. And now you'll see any of the information I entered on that last patient visit. So a nice way to see where your patient was very quickly and easily during the last diabetes visit. But if something is no longer relevant, it's very simple just to edit and remove or add something different here. We do put some drop-down boxes wherever possible. try and limit that documentation. Now, if you wanted to just start fresh again, you can absolutely click this clear form and you have a blank chart to start with. Things like blood pressure and the other vitals can be entered right into the tool by clicking on the blue value. Now, my poor test patient here did not have a good couple weeks, but he's doing better now. You're able to trend those results over time. We do have some additional note sections included for any notes that would be related to the assessment the clinician would like to keep track of. And then in this specific complication and monitoring comorbidity section, we have a few columns here. So the first column would indicate that the diagnosis has been confirmed when this is checked off. The date, this was last done, so either confirmed or maybe they've gone, the clinician's gone in here, they've screened for neuropathy, but neuropathy wasn't confirmed. If it was reviewed, or it can be left blank. So the date will show. Any of these blue icon buttons, these are found throughout all of our tools. When we click on them, we get additional information on best practices. And again, that's to help with that clinical decision-making. This has been wonderful. Our team has added in the in-low foot screen here, so it's completely fillable online. Once you go through and you enter whatever needs to be entered, maybe I should fill out some more so I get a score. You will have your score at the end. We'll have our score here of 2. We can add it to the notes, so that goes into the body of the chart. And the next time we open the tool, we will see that the score was 2 and we will see today's date. So the last time I did this was the January 9th and also a score of 2. For the monofilament test, you're able to click off if this was done. So I'm not doing this again today maybe, so I'm going to remove that. And that was there because we used that insert from previous button. So maybe I screened about, I asked my patient if they'd been to the eye doctor. And yes, in fact, that was up to date. So I'm going to note that there. But I screened them for a dental visit and they haven't had that. So if I click this button here, no add to reminder care plan, later on when we review that care plan, it will actually be a reminder added to their care plan, asking them to follow up with that as part of their next steps. So EKG results, we have not applicable, normal, and abnormal. It will give the date of last done. Now, there is a bit of limitation with ECG. And the reason is, as we all know, labs send information widely differently according to region. So unfortunately, there was no consistent way to pull that value in. So what the team's done is they've created this filter imaging button. If I were to click that, I don't really have a lot of imaging in my chart, what it will do is it will filter the body of your chart to show only imaging results. So you're at least able to narrow that down, see when the last imaging results came in, and quickly and easily find that information to be able to add it here. Again, we do have more of these blue information dots housing those best practices. We do have a lipid profile. So very similar to other areas of PS, we have red values are high. It will show us when something is due. By clicking on the blue vitals or lab values, we can track those results over time. Now, this little gear here, before we move to the GAD-7 and PHQ-9, and this little gear here, these will allow you to customize based on the patient chart you're in when you need to screen, what that frequency is. So we do list the default, what would be considered best practice. And maybe at a point I wanted to screen my patient every 3 months, their A1C. I was quite concerned about their blood sugars, but now they're doing a little better. So I can move it back to 6 months. And again, maybe I want to check them for neuropathy in 6 months instead of 12. I can make any changes I want and based on that patient. I add it to notes. The next time I open the tool, if 6 months has passed, it will now say due. It won't wait that 12 months. It will be based on that patient's values. And our PHQ-9 and our GAD-7 are fillable within the tool itself, so you don't have to leave the tool. PHQ-9 and GAD-7 are able to be emailed through Ocean. If that's part of your existing workflow, and then that will flow back into the chart. If you're using a different PHQ-9 or GAD-7, those values will also pull in, which is really nice. And then again, you can track those results over time. You'll see when something is due, my client needs to be checked for erectile dysfunction. I can click that best practice information. I can open, here we go. I can open additional information from within the EMR to access. And then in our lifestyle and self-management considerations. And again, this was all clicked off last time. So maybe this time we didn't discuss physical activity. So I'm going to, maybe we'll leave that one. We didn't discuss diet this time, but this time we did talk about planning for sick days. And we did still talk about sugars and the importance of monitoring their sugars, but we've already referred them to diabetes ed, so we're going to remove that one. And I asked my patient about smoking, and maybe they quit smoking, and that's fantastic. So we're going to click that off as well. And that will actually end up pushing back to the chart. We're just going to move that there for a second. That will push back to the CPP and update it. So you don't have to go back into the CPP and update that as well. Once it's done, it's done. And our medication section, so the team has gone through and created this great resource. So it's divided into 3 different sections: insulin therapy, non-insulin therapy, and combination products. So
So Kathy, to confirm, we can't see the browser window.
Oh dear. Okay. You know what I'm going to do then? I'm going to, if everyone's okay with it, I'll leave that right till the end so I don't have to bounce out of PS and back in again. Okay, wonderful. Thank you for letting me know. So we'll check that at the end. There is a place to note any medication adherence issues. So my client here, they were not taking their medication with food, so we discussed the risk, and maybe we reviewed that again this time. Maybe the medication is helping now, but you know what? Unfortunately, we are having some side effects, so a place to know what those are. We have our different classes of medications here and the recommendations for who should be taking which medication. You're able to click whether there's something is prescribed, not prescribed, or you can leave it blank. When you go to prescribe a medication, you would choose it from the list down here, and it's actually quite an exhaustive list. When you click prescribe, it will pull that medication name into your prescribing model in PS, and then you go through and prescribe the medication the same way. You will end up with a little summary here of when you've discontinued a medication, if you've come off it for maybe the side effects were too great, the risk outweighed the benefit. You can make notes of that here, so you have that in this living document. This is a long journey for patients, and the tool truly is designed to be built out over time, especially with the team care approach. Having all the information in one location is very helpful. So we do have immunizations when they're done here, the last date, and the ability to perform treatment from within the tool. So you are able to open the Ocean Health Map. I'm not going to click on that now that I know you can't see my web browser, but it just opens Ocean Health Map. You want to send your referral to the Diabetes Education Center or maybe an endo doctor, you're able to do that from here. And this is where our user analytics are. So the first time a clinician opens the tool, they're actually presented with a message asking if we can collect user analytics. We do not have access to your EMR. We do not collect any personal health information. What we do ask is if people are willing to let us see what clinic is using the tool. So we would have the clinic name and address. We have a randomized code for a clinician, and we would have a randomized code to identify unique patients. Like I said, no identifying information. We see what sections of the tool are used and the date and the time the tool is used. The sections of the tool truly helps our team to know where to focus their efforts in the future. If every single person uses the medication section, it is very important that we put a high priority on that. There is no obligation to do this, and consent can be taken back at any time. As I mentioned earlier, we do really appreciate having feedback, so you can always email our team or the change management person you worked with, but you're able to submit it here as well. So the nice thing about submitting feedback here, if you actually leave your email, you don't submit it anonymously, which absolutely fine. Myself, my colleagues, the change management team, we follow up with the people who provide us that feedback and let them know what happens with it. So we're able to say, you know what, this has been roadmapped, or, oh, we found out this is, you know, the intention for this piece here, or this is how you can use this. Great feedback. Thank you. We appreciate that. We're working on it. So it's maybe nice to know for people that the feedback made a difference. When we're all done at the end, we click Generate Summary Note. And what we have in the tool now is a nice little summary note, very similar to a SOAP format. So any area we added information, edited, changed, it is all listed right here for us. If you did want to see the full tool, you're able to click here and expand it and see the tool right here. So I'm going to go back in here and I'm going to show you that care plan. So there's a way to access it here, and it's also at the bottom of the page. So the care plan has been divided into sections. We do have insert from previous again. So we're able to click that. Ask us to confirm. Now, in our care plan, you can choose all, or you can choose by use case. So today we will choose diabetes, and I'm just going to click off all of these except for our heart failure. And well, I'll show you the heart failure and COPD as well. So the reason these checkboxes were created is when we launched our first heart failure tool, this palliative care section, we had some feedback that it wasn't necessarily something clinicians wanted to share with newly diagnosed patients. They recognized its importance, but not day one. So that's why this was created. It lets you customize based on what's checked, what would be included in this care plan. So for today's purposes, I'll just leave this full. But what you can do when you're working with a patient, maybe you don't want the care team included. So that has removed the care team here. And if you show printout view, you can notice it's no longer here. And this will actually be what the patient sees. Now, the reason that's important is because this is designed to be patient facing, and it can be emailed via Ocean or another email platform. You just green bar it and email it, or you can print it out and give it to your patient. So especially for heart failure, I'm talking to more and more clinics that are printing the heart failure care plan out for their patients and saying, you have to go to Emerge, you take this with you. It has all your information included. So maybe those were the resources we shared last time, but this time we were a little more concerned about neuropathy. So we're going to share that one, and we're going to share the diabetes patient guide. Now I can click on these links and it would open in the browser. So we'll leave those. I think people are probably quite familiar with some of these resources. Anyone listed in the care plan in the chart would be pulled in here. And last time we wrote some goals in here. So maybe they're doing great with this one here and they are limiting the desserts and their sugary drinks. So we're going to take that one off. My patient doesn't have any allergies, but they still are going to be working on staying active 30 minutes a day. We did make a little note here about metformin and, used with a proper diet. Now, this typically would be left on for diabetes, obviously, but we're just to give you a little visual. And with our new tool coming soon, we'll have an action plan here for COPD. We do have, sorry about that. We do have some follow-up and next steps for a patient. We're asking them to remember to monitor and record those sugar levels. And then this one here is that palliative care approach. So a place to enter their symptoms, what they should do, any comments, some of the psychological support plans, social, spiritual, grief and bereavement support. So starting to look at some of those social determinants of health. Substitute decision maker, a very important one for folks. Not everyone has it in their chart yet. This will open up the substitute decision maker tool right within the tool. Once you fill this out, you can print out the handout to give to them. It can also be emailed, and then this will push back to the chart after you click add to notes. There's no additional steps required. For now, we're just going to get rid of that one. And then this will be listed here as well. So our two, sorry, did someone have a question? No. So our two resources are listed here as well that we shared earlier. And then when we're done, we just add to notes. Now, you don't have to leave the tool to do this. You can do this all in one shot. So we are going to discard this tool only because we already saved it a moment ago. Now the care plan does come in expanded, and the reason is it was intended to be green barred and emailed right away or printed, but you can just go in and collapse it once that's done. So I am going to go in here one more time just to be able to open the medication reference tool, and I will reshare my screen so everyone can see that. Oh. It's been a little bit of time since I've used Zoom. I'm out of practice. There we go. All right, is everyone able to see that? Looking wonderful. So here we have our three different sections, our non-insulin, insulin, and combination products. So by clicking on any of the categories, it gives us the generic and the brand names, kind of the goal of that medication. So this one's obviously reducing our AC1 levels, any weight implications or hypoglycemic. So really just a nice overview. I'm wondering if I can move this one here. I can. So we do have a legend here as well. Just because some of you may not be quite as familiar, right? The little circle with the heart, or the heart with a plus sign, that means our positive outcomes. So just good to know. There's one here that has some smiley faces. Oh, that's our mental health tool. So yeah, just some really good information when clinicians are trying to look at those medications and what maybe makes the most sense for their client. So that is another great reason to reach out to the academic detailers as well. They do meet with physicians and nurse practitioners, and they can really help with that medication support, especially in finding with the shortage of different insulins lately. So that's always available to people as well. Both meeting with myself and the detailers is MainPro Plus credited. And again, no charge, and we do our best to work with everyone's schedule and really meet people where they're at. Jeremy, would you like me to share that other slide?
Sure. So there was one last slide, which I think is a really great summary to kind of bring us back around to review kind of everything that we've seen today. and really helps to highlight just some examples of how clinical priorities for the management of pre-diabetes and type 2 diabetes can be supported and measured once the tool has been implemented and potentially used for a period of time. So whether you're looking to see the proportion of up-to-date HbA1c testing, whether you're looking for up-to-date retinal exams, those with age 66 and older with a statin dispensed, there are direct links within those tools that help to measure those priorities, to kind of increase the adoption and implementation of those. We do our best to really understand what some of those goals and priorities are to improve the quality of care for a particular patient, and make sure that we're able to articulate and to map out where it is within the tool and how we are addressing those pieces. So that's really what this slide and what this table is hoping to illustrate. So if we flip to the next slide, is our kind of wrap-up slide. Want to thank you again for the time that you've given us this evening. Very, very much appreciated with your busy schedules and kind of going into this late hour. So we do have Kathy's email right there if you wanted to reach out with any questions. Or you can do an internet search, find the E2P program, and take a look at our website. So with that, I think we've got maybe 10 minutes if there is any questions or discussion that we can help to facilitate.
Great. Anybody with questions?
Yeah.
Yeah, go ahead, Lucy.
It's just when you green bar the care plan and email it through Ocean, the links, will the patient be able to just click on the link and then it'll pop up from the email?
They will, yes.
Great, thank you.
Yes, you're welcome.
And sorry, and the other one is this for CPSO quality improvement programs. This can probably, I'm sure this can be used for the metrics there. Do you know if physicians are using it for their CPSO quality assurance program?
For the new initiative that came out maybe 6 or 8 months ago, I haven't heard yet, but I would assume it would fit. Jeremy, have you heard of any specific clinicians using it?
I can't think of any specific examples, but I have the same inclination that you do. We can take that back and definitely verify
Absolutely.
that if there's any gaps, but I would assume I think it should fit quite well.
I
Okay,
think so too. Yeah,
Thanks.
I'll follow up and let you know.
thank you.
And I think this tool is a really good opportunity to start thinking about how a virtual team could come together eventually. It's certainly not in the next 12 to 18 months. But if someone were going to a diabetes program at a different organization, but that organization were documenting in the same sort of tool on the same platform, then, you know, when Dr. Carter or Dr. Lajoie saw that person, I don't know, 6 weeks later, the documentation from the previous visit with the DEP program would already be in the same tool, and it wouldn't be a fax just sitting there as a picture. It would actually be data for and support for filling out the documentation that we need for all of these chronic conditions, which are so hard to manage as one person. They're much better off as a team. Any other questions? Sorry.
Yeah, and I was just going to add to that we are also working very closely to align these tools with the integrated care pathways as well. So as we know, heart failure, COPD being big pieces in those integrated care pathways, but even lower limb loss prevention is kind of associated with that, and that's built right into that INLOS INLOS test that's in the diabetes program as well. So any sort of efforts being made to develop those integrated care pathways, we are trying to make sure that these tools provide value to those pathways as well.
Super. All right. Well, thank you very much, Kathy and Jeremy. Much appreciated. I see Etienne unfortunately had to step away, so his part of our presentation will have to wait for another day, but that's okay. We'll move on with Kelly, and I'm sure if any of the clinics, I will be passing on the recording and your information, the slide deck, and so hopefully you'll have a reach out from a few of the clinics. We are a vast majority PS Suite OHT, so we do have some amazing opportunities for several clinics to onboard with this tool.
Wonderful. Thank you.
Thanks. Take care.
Bye.
Bye-bye.
Right.
So yeah, I mean, Lucy and Vanessa and Megan, if any of your clinics are needing support, I'm happy to support working with the E2P tool and your staff. Obviously, I don't have access to your EMR, so I can't do the work for you, but I can take on some of the role of working with the E2P program and your staff to get that tool embedded, and then making sure that you have a level of comfort and your colleagues have a level of comfort to actually use the tool if you decide to proceed. So happy to support that. With that, I'm just going to let Kelly Lynch speak about the resources and programs. So Vanessa, this second part actually comes from your comment at the event in November about what programs and services you have access to as a provider who's not in a team-based model. And, you know, our goal in the OHT to actually create a virtual version of a team-based model for everybody, regardless of whether you're a faux physician or a solo nurse practitioner out somewhere, that you have access to similar resources and services. So Kelly's going to show a few things about this Seaway Valley CHC and the programs and services that you may or may not know are available and where they're available. Etienne has similar programs and services at the San Santé, some of which are actually available in both languages. They don't have to be for francophones, but I'll let him speak to that at another time. So go ahead, Kelly.
As mentioned, my name is Kelly. I'm the manager of primary care at Seaway Valley Community Health Center, and I'll just share my screen. So as far as programs go, they could all be found on Oceans or on the Great OHT website, or even our own website. If you just go to Seaway Valley CHC, you can see them there. But from an Ocean standpoint, if you just do a search for Seaway Valley, help if I, there you go, and you just go to the community programs. This map needs to be updated. Our catchment area is a little different. It's bigger than this. I'm not sure why it's just a triangle, but if you go through, it kind of gives you an idea of what services. So if you go Balance for Life, you can we're accepting referrals and how to go through what it gives you information. You can send a referral through, just fill it out. Oops, sorry. And then we have diet, nutrition, family medicine. There's a nutrition counseling workshop, respiratory therapy, respirology, smoking cessation, supervised exercise, rehabilitation programs, and so on. So all that can be sent directly through Oceans. And if you go to the OHT website as well, and you just do a search for Cornwall, Ontario, and you go through, it'll tell you where we are. So we have a lung health program. We have a lot of different programs, but it's all available there. And then for food, we have some programs as well around food. I'm not sure the nutrition dietitian, sorry. So we have a Healthy You. We have there's some for Sound Sleep as well. We have Introduction to Mindful Eating, this I can't pronounce it for some reason, so I'm going to stop trying. Hearty Health at Eating, and so on. So all these programs can be found on the Great River website as well. And as mentioned, our website, if you have any questions, you can go there and it'll show you a list of our programs. And if you can't find something on Oceans or on Ontario Health, don't hesitate to call us. And you can speak to someone who can point you in the right direction as to the program that you're looking for.
The nice thing about the OHT website is that if there's an opportunity for someone to do a self-referral for most of those programs, they can just click, you can just give them the OHT website and then they can go on and make a referral. If they're looking for a Meals on Wheels program, if they're looking for foot care, if they're looking for 101 things that patients ask us for, and we're not care navigators, we have no clue. Then sometimes just giving them the website and letting them search by their home community and what service they're looking for, or if they're looking for something for their mother or their uncle or their cousin that they're helping navigate their health services with. The OHT website really has some opportunities for that. Any questions on those things?
You answered the self-referral one. Is there also any type of short version paper documentation that we can put in the offices or provide to them when they come and see us, or no?
For the patients, you mean?
Mm-hmm.
You mean for the website?
Not for the website, but for Seaway Valley, if there's a poster or whatnot, or a pamphlet that you have of a summary of your services or the programs that you have.
Yeah, we can definitely get that to you. I'm not sure. Well, if I just get your email address, I can have that forwarded out.
That's perfect. Thank you.
Yeah, and a lot of Seaway Valley stuff, as well as the Leslie stuff, is posted on social media, so it's on Facebook and
it's just
that
because
sort of thing.
oftentimes it's not young individuals that are coming in, it's our elderly. And
Mhm.
I mean, sometimes I have family members that come with them, and most of the time they come alone. And so sometimes it is that snail mail or that phone call that would be, that works better for them.
Yeah, for sure.
And we have some both social programs for individuals to attend. They just come to the community. There's a meal provided, and they just take part in activities as well. So there's a lot of different programs that we offer. So I can get you the list for sure.
Great. Well, it looks like I'll be sending this out as a recording to a lot of people because as I said, I had 14 people accept, but obviously people's days went different than they had anticipated. So, but Tracy, I think for our diabetes integration program, you can see how that E2P tool would be wonderful to have, and wonderful for the diabetes programs to be doing the documentation, at least, the stuff that's relevant to them, and then being able to share that with the family docs and the nurse practitioners to ease their documentation burden and their work.
Pretty interesting how that tool is so integrated to move between the screens and different things, and it's all very, it looks really well thought out.
This is, I think, version 2 or 3. It might even be version 3. I can certainly say the first version was a very good attempt, but it was not nearly, again, first attempt in learning, right? So this is far better and really nicely laid out with the ability to just pull everything in. So labs pull in and vitals pull in, and those sorts of things. So makes it much more seamless.
From a patient perspective, I really, really like the care plan. I like the idea of being able to provide a care plan and say, if you have to go to Emerge, bring this with you. It has a summary. I have to take my mom to a medical appointment Monday and she knows nothing. And I know nothing because she knows nothing. So I'm like, great. It would be great to really know what this is really for and what I should be looking out for. So I really like the idea of, it seems to be very patient integrated and friendly and there's multiple uses that it can have from a patient's perspective. So I like that idea as well.
And having that care plan, for example, if you had somebody on an RCM program or on the community paramedics program, would provide some great communication opportunities between the family doc, nurse practitioner, and those other programs as well. So I think there's lots of work that we can do. It's just a matter of, time and effort and energy and that sort of thing. So, any other questions from any of you, Megan, Lucy, Vanessa?
No, I think actually it's going to be, I can see that Brent, Hannah, and I definitely will email her because we've been talking about making tools or trying to make documentation easier for us and getting together and make these. But honestly, if they are made and we just have to implement them, that would greatly alleviate and just again help speed up the process a little bit documentation standpoint. So yeah, no, I'm really happy that I sat in on this, and we'll definitely reach out to him.
Yeah, and the other piece, well, Megan, your clinic is going live hopefully this month, if not the beginning of next month, with online booking. And I know you guys have been doing messaging. Vanessa, do you guys do ocean messages or other kind of messages with your patients?
I don't particularly. I can't foresee Hannah, maybe Brent, but
do you have licenses to be able to do it or not? Or do you just have Ocean for e-referral and e-consult?
I would think that it's probably just for e-referral, but I can't say.
Well, because for messages you do have to pay for it. That's a paid service.
Okay, then if I know I'm not using it, but Brent might be, but I can't see that. He's never mentioned it.
And Lucy, are you guys using Ocean messages?
Yes, just me, and just 3, I think, of the physicians in the group are using it in the FO. Yes, I'm really, really liking it.
Right, because Kelly's working with me on the cancer screening day that we're doing. We did the one in November, and we did that kind of more on paper, for lack of a better way of putting it. But we're doing a new version on February 3rd. And we've actually built, or he's built, I have done nothing. He has done the work. Built the intake form and the whole 9 yards so that people can do online booking and then do all the screening intake, answer the questions about their family history and their this and their that and the other thing. And then by the time they come in, their charts kind of they've got what they call a stub chart, which is like, what's that? It's a started chart. And then all of the Ocean information is already in the chart. Kelly, do you have that handy? Can you show that?
The form?
Yeah, if you have it.
Yeah, it just take 2 seconds. Got to log in. So
it's just absolutely amazing. So you put in you need sex at birth, so we know if you're a trans male, then you maybe still have a cervix, and your age, and it actually has enough smarts in it to be able to show you, the tests that you should be offered. So go ahead and share screen when you're ready.
Share. So it would look different when someone's filling out because this is just a preview, and so this panel box here wouldn't show up. But we just have the criteria for the screening. So if we look through, okay, I thought I removed this, so I'll take the lung screening out for the family history. But so it just asks what your sex at birth is. So if I say, I'll just go for female at this point, and then because I clicked female, then the cervix screening comes up. Nice. I thought I removed all this, but it didn't take. And then it asks how old am I. So if I say I'm 23 and go through, then it'll ask me about the pap test. If I go to 58, then it'll start asking me about breast cancer, colon cancer, and lung cancer. But for lung cancer, you have to be a smoker. So if you are a smoker and you say yes, you need to have smoked daily for 20+ years. So if I say no, it ends there. If I, well, not no, but if I answered less than 20 years, that's it. If I say daily, then it'll ask me, have you ever had a lung cancer test? If I have, when was it? And was the test normal? And all this would pull into the EMR. Same with the, have you ever had breast cancer test? Yes, no. And if no, it's no. And if yes, it goes through these questions. And what we will do then at the cancer screening clinic is take this information and then go into OLIS and so on to gather the information to get the results. So that way we can share it with the providers that are attending, and so they can review and determine what the next steps are. Do they qualify for cervix screening, breast screening, colon screening, lung screening? And then they would move forward with those tests as needed.
So we're using this kind of a tool primarily for the unattached population, because most people who have a family doctor and NP are getting their screening at their provider's office. But these are the kinds of things that can actually go out if you automatically in advance of your appointments, even if you just have messaging, even if you don't have online booking. So if you have your appointment type set up for well baby 6 months, it'll recognize that, and it'll automatically send out the 6 month work however far ahead you set it for 3 days, 5 days, whatever, ahead of the appointment for the well baby. And then people come in and the work is already done. So there's some really great opportunities and things that we're doing at the OHT. So if your clinics are interested in some of those sorts of things, happy to help with those things as well, or share that information with others in your groups, even if you're not interested. So awesome. So thanks so much for coming. And as I said, I will share the slides and I will share the recording so that people can catch up on things that they were unable to attend today. And for those of you who do long-term care, I have the point-click care presentation tomorrow evening. So if any of you are attending that, I'll see you there.
Thanks, Marilyn.
Thanks, everybody. Take care.
Good night. Bye.
Good night. Bye-bye.
Thanks. Have a good night.
Hey, before I forget.